Production Quality Assurance faculty will be continuing with lean manufacturing principles. So that's the class holding right now.
My name is Monica Ago. I'm part of it. We're all learning together. The lean manufacturing principles. And the learning objectives for today, we need to understand what the concept of lean manufacturing is, and also understand the lean manufacturing principles. So we also need to have knowledge of the tools for implementing lean manufacturing and tailoring their application to the pharma industry, because it's originated from a non-pharma sector, actually the automobile. And we also need to gain insight into how to transition from traditional batch processing to a lean, agile, and globally competitive manufacturing model. So the case of lean manufacturing in the pharmaceutical industry in Nigeria, the pharmaceutical industry in Nigeria faces a lot of challenges like high cost of API, supply chain volatility, and also high cost of finance, which many of the facilitators have already talked about. And lean can actually help us in cutting some of those costs by maximizing patient value and eliminating waste. Because in our manufacturing processes, there are a lot of steps that are actually waste. Some of the processes are contributing to waste, and those are the things that we need to look at. The goals is to increase right the first time. If you do something and you get it right the first time, you are actually saving your company a lot of money. But if you have to rework, then you are actually wasting resources, wasting time, and it's not going to help the patient, because the company will pass the cost on to the patient, and it's not what the patient actually is not value. You're not adding value to the patient. So the impact is reduced lead time. Lean actually helps you to reduce lead time and lower inventory cost, because when you have a lot of inventory, there's cost for maintaining that inventory, and the patient is not really, if the patient is aware you're moving that cost to him or her, they are not really willing to pay for it. It's not value adding to the patient. So lean will help you to also increase your compliance with WHO and NAIP. Next slide. So what do we mean by lean manufacturing? It's actually a systematic approach of identifying and eliminating waste, which are non-value adding activities in your process, through continuous improvement. Because if you have wastage, you are making your company, because finance is expensive, the little resources your company have, you're now making them to spend it on maintaining inventory and having a rework, and it's not going to be a good thing for the patient as well, because the patient is paying for what is not adding value to him or her. So lean manufacturing principle actually originated from Toyota production system, and it focuses on delivering maximum value to customers while maximizing resources, time, and effort. I don't know whether any of you remember, next slide, whether any of you remember the saying, is a slogan from Toyota, good thinking, good products. Who has heard that before? So this is the origin. The thought process that made Toyota to get it right the first time. It is the thinking that goes to eliminating waste and getting it right the first time. So that slogan started since 1953, and it is the basic thinking that has guided Toyota's journey and led them to the just-in-time and the Judoka concept. We are going to explain what that means. Just in time means making what is needed But if you produce something and get it right the first time, you are actually saving resources. But you have to rework the time you should have used for other things, and rework will cost more. It is going to cause a lot of disruption. You're going to do a lot of investigation and all that to find out what led to that deviation that you have to have not out of spec products. So just in time is about making what is needed when it is needed in the amount that it is needed. And the doctor is when there is abnormality, machines automatically stop and people suspend their work. Why do they do that? They don't want to pass defective product to the next stage. So that is the strength of Toyota. That is what makes them tick. And that is the thought behind that good thinking, good product. And Toyota actually enables every employee on the floor. If you identify any issue, you need to flag it. For them, that person can actually stop the process. Everybody has the right. You don't need to kind of report to your manager. But because we are in a kind of controlled industry, you cannot do that because there should be process of change control. So for farmer, everybody in the industry should be enabled. A country that is implementing lean enables their employees to flag any red flag to their supervisor, who should now take it through the process of change control. So the Toyota thinking was actually working for them, but there are two gentlemen that articulated it into a book that made it popular today, that so many industries are adopting lean manufacturing principles. And they are James Womack and Daniel Jones. They captured the Toyota production system into 5 core principles in their 1996 book on lean thinking. And the principles are, the first one, you need to identify value. What value does your customer need? The patient, what is the value they want? You need to identify that. Then the second principle is you have to do a value stream mapping. You map the value stream. The third one is you create flow, establish flow, and ensure perfection. So the next slide. The principle number 1, which is identify value. You need to determine what the customer, that is in our own industry, the patient is willing to pay for. Your patient is willing to pay for quality, safety, efficacy, and consistency in supply. The patient is not ready to pay for 6 months inventory in your warehouse. So if you stock up inventory and it's costing you money to maintain that inventory, and you now pass that cost to your patient, that is not what they are willing to pay for. You're actually making them to pay much more than they should. So lean will help you to remove those processes and those stages in your process that is now costing the patient more than he or she is willing to pay for. The second principle is that you map your value stream. And it's about mapping the complete sequence of steps required to deliver value from, to the customer. From your raw materials, right from the point of importation and import, until throughout the production process, till your finished product gets to the pharmacy. So you need to map every process, every time consumed in that process. Value stream mapping shows every step in production sequence, the time each process, each step takes, the wait time. What is the time you need to wait maybe between granulation and then tableting? The different time you wait, the wait time in between each step, you need to map all of them. And all your process too, how long does each process take? You need to map all of them. So when you have done that, you also map the information and the documentation flow that should go with your production. Your batch manufacturing records, your in-process control records, the QC analysis and all that. you need to map the flow as well. What time does each of those documentation and information flow from where it's generated to the next stage? Do you have to wait unnecessarily for quality control to finish the analysis and then you keep following up to be able to get your result before you go to the next stage? So every process, every step, every time you wait in your process, you need to map it, you need to step it, so that you'll be able to now say, okay, which ones are actually adding value to the patient and which ones are waste. Because all those stages, all those waiting time that don't add value, you need to eliminate them. That is what lean is all about. Because those waiting time is money. Also, even in your production flow, your flow, that's why another will tell you that you have a proper flow. Or do you keep crisscrossing the entire production flow? You do this, you come back and all that. The movement that the production staff do, going back and forth, is a waste. There should be sequence in the production from one stage to the next, so that you save valuable time. Even changeover between one bank and another, the time you have to do line clearance, how long does it take? If you need to change from dosage form to another, then the time that you need to do for the next product, you have to wait until end of that process before you start assembling what you need for the next one. These are all the things you need to write down. That is what that mapping of the value stream involves. Okay, so when you have mapped your value stream, which is all the production sequence, the time each step takes, the wait time between steps, the inventory accumulation at each stage, and the information flow that triggers movement. So usually the first time you do the value stream mapping, for most manufacturing processes, it will reveal the actual value adding time as a fraction of all the time spent, and it's a very small fraction. You'll notice that there are a lot of things you do that are actually waste, which you need to eliminate to make your manufacturing process a lean one. So, for any company that wants to do it anyway, I think is one of the slides, you need to have stable process. And you can't just, it comes from your process validation and all that. You can't be operating an unstable process and expect to do lean and then succeed. Because today is something else, tomorrow is another thing. A process that takes you this length of time today takes you longer time tomorrow. It's not stable. If one process should take you 30 minutes, it should be consistent. So that when you map it, you know that this process, this step, takes me this length of time. And between this step and the next step, this is the time we spend. So that your value stream that you have mapped is actually what it is. Not that if you map it today is one thing, you map it tomorrow is another thing. So stability of the process is very important. So the rest time is waiting for machines to be available, waiting in queue between operations. That time you wait, you have finished one step, you are waiting, not doing anything. It's actually a waste. So these are the wastages that we pass on to the patient. It doesn't have value to them. And these are the areas we need to look into to reduce those wastes, because all those things are money. If you add it up, it is money. But then the company is not able to get enough funds to be able to improve, and you're also passing that cost to the patient, which is unfair. So value stream mapping produces two maps. You have to do the current state, what it is now. Then when you have identified all those wastages, that will now help you to now kind of design the next map, what the ideal one will be. Not really ideal, but the future one, where all those wastages have been eliminated. And it will also help you to know where your priorities should lie. Which ones are those ones that are really the heavy cost center in that wastages you have identified. So the first stage, the difference between the gap between the current state and the future state, to define the improvements agenda and the priorities that you should focus on when you're performing your lean operation. Next slide, please. Then the principle number 3 is that you need to create flow. You should ensure that the value adding steps in production run in tight sequence. There shouldn't be lag time. It's not when you finish this one, you wait idle time before you start the next one. It should be in tight sequence, because actually batch production is actually prone to a lot of wastage. Continuous manufacturing is actually what lean supports. Few companies are already doing that when they have automated manufacturing process that starting from the beginning, it's continuous. There's no break. That supports a lean operation. But even if you're still doing batch manufacturing system, you have to now watch it that you reduce any of those processes that will make you to wait longer than normal. You reduce it. Whatever, like in compression, you're going to change over from one formulation to another, like from paracetamol to ibuprofen. You don't have to wait until you have finished and cleaned and done everything, done your line clearance, before you start assembling the punches and dies and everything for the next product. So instead of waiting, a set of people can actually be assembling all that you need for the next product, so that as soon as you finish your line clearance, you'll be able to transition into the next product within a short period of time. So these are areas that you need to look into to reduce waste when you are implementing the lean system. So the most common application of flow principle is improving speed in individual processes without addressing the flow between them. It's just like, okay, in granulation and then compression, you make sure that your granulation, everything, the speed, everything is done fast. Compression, the same thing. But then that time lag between the two, you're not doing anything to shorten it. So if you do that you're focusing on the process to make it very, very efficient, and you're not looking at how to reduce the time in between the processes, you're not getting it right. So that's some mistakes that some companies will make, and they will say, oh, this is not working. So production activities should be sequential to achieve proper flow. So the first principle is establish flow. In this principle, you don't produce according to forecast. You produce according to demand. Demand is the pull. The forecasting is actually the push. You forecast, okay, we are projecting that we are going to make a sales of this volume in the next quarter. Okay, production, go ahead. They produce everything and push them into the warehouse, and their inventory. The warehouse staff are busy trying to maintain it in a clean state. So this particular one is that you need to establish the pool. There has to be demand generation from the marketing team to be able to now tell you, okay, we will need this amount, so that you produce exactly close to what they need, instead of producing and storing it in the warehouse. So production is actually triggered by customer demand rather than by production plans and forecasts. And the alternative to pull is the push, where they make the forecast and the production plan, and they produce a lot and they fill the warehouse, and the market is now going about looking for customers to buy. So that is against the lean process. And in a push system, the upstream operation, like let's say granulation, tableting, they produce according to schedule and forecast, leading to production, overproduction, that accumulation of inventory. Because you find that sometimes there are a lot of granules, and because there are parts where they have to keep them in the warehouse, they now have to schedule when the compression will be done. So in a lean process, there has to be demand generation from the marketing team. Then that will inform what production should produce and move to them, so that it goes straight to the customers instead of lying in your warehouse. Also, the push generates work in progress inventory accumulation, like I said, at every stage. So you see, you may have some granules, you may have some compressed tablets that are waiting for blistering. So every stage you see work in process, and then that section is filled up, and they have to start checking, okay, when are we going to tablet these granules, and then the stability of those, because sometimes maybe you have not even done the stability to find out how long those tablets can stay in that bulk form to still be stable before you compress them. You just leave them, okay, when they are ready, okay, they want this product, you go and pick that one and compress and then package and send. So it's all, even in terms of quality, it is a red flag. So the push hides process problems behind inventory buffer. That producing inventory buffer so that we don't face stock out. The push process, hides under that. We need buffer stock. We don't want to be out of stock. So they produce and shift it in the warehouse. So push process hides all those problems, which needs to be eliminated. The pull makes process problems immediately visible. When you're operating the pull process, all those issues in your production process become visible so that you address them and remove them, and the process is now smoother. Then the Kanban system is the most widely used lean tool. Later on you see some of the lean tools are also stated, but this one is used for also implementing the pull system. And one is a signal or a card or a container, even an electronic trigger that will authorize the upstream to produce what the materials that the downstream need at the right time. Like let's say for packaging materials, the Kanban can be like two different maybe containers of maybe labels. By the time the first one is being exhausted, it becomes the pull that should trigger them to reorder. Instead of you fill the whole warehouse with labels, so we don't want stock out of labels. So using this, you can actually use it to manage your inventory for labels, packaging materials and all that. So to establish pull, we need to ensure process stability, like I said before, and consistency in product quality. Because if your process is not stable and you don't have a consistent quality, you cannot implement lean manufacturing principle. The most common misapplication of pull is implementing Kanban in unstable process, like I said. Process stabilization through standardized work process, and also quality improvements must precede before you start the project of going into lean manufacturing. So your process validation, everything has to be right, so that you're sure that when you start, if your time for granulation should be this, it should be consistent. If the tableting of a certain kilogram of tablets should take you this length of time, it should be that. Not that today you do it, tomorrow it varies because your process is not stable. And that shows that you didn't actually get it right in your process validation. The fifth principle, which is the last one, is you need to seek perfection. And this is about continuous improvement. Lean is not a one-time event. There is a continuous cycle of improvement known as Kaizen. The keynote speaker today mentioned it. The process of continuous improvement. In lean process, you keep improving. Nothing is too good to be improved. So in a lean process, it has to be a culture. There has to be a quality culture in the organization, culture of continuous improvement. So that in a lean process, everybody is responsible for quality. And you don't see something going wrong, say, oh, it's not my job, and you keep quiet. You have to flag it. So that your supervisor, your manager picks it up, starts the change, testing it to see actually whether it's something that will lead to a kind of change that will be handled through change control. Elimination of one level of waste will always reveal the next level that was previously hidden by the inefficiency of the one you eliminated first. So it's a process. If you start lean and then you notice that you're noticing a lot of things, don't think, oh, this is even creating problems. No, it's identifying those wastages that need to be removed
for you to have a lean manufacturing process. Because the first one you eliminated was actually hiding some other ones. When you eliminate it, the next one becomes visible. And it's now for you to eliminate it until your process is very, very lean without wastages. So when you're seeing that, it actually means that your lean system is working. Because problems that were always present are becoming visible for the first time. Because the buffers that were hiding then have been eliminated. Kaizen is the Japanese discipline of continuous incremental improvement that empowers every employee to be able to make spot any, if you identify any issue, to bring it up. In pharma industry, you need to flag a bet. In Toyota, every employee on the production floor that notices a problem can stop the process. Every employee is authorized to do it. They stop the process, the problem is fixed, the line is restarted again. Because they want to get it right the first time. They don't want to pass on defective product to the next. So that is lean for us. But in pharma industry, I keep stressing it, we are in a controlled industry. You don't notice something, oh, I think this thing, no, I need to change it. No. You have to work with your SOP. If you notice something, through the process of change control, inform your supervisor, then the process of the due diligence will be done. And if it's something that actually requires a change, there's a process of change control. Some of the changes may even require investment. So it's not something that you will just wake up and say, I started it, no, this thing, I think we should stop this one. We should do it this way. It has to follow your SOP for change control. So to implement Kaizen in pharma industry, like I said, every employee should be empowered to examine their work for waste and report identified waste to their supervisor with suggestion for improvement. It's not a question of, oh, this thing is a waste. You know, Toyota say good thinking, good product. As you're spotting the waste, also think of how it can be improved upon and make the suggestion. It may not be the process that is adopted, but at least it makes you custodian of quality as well. You're interested in making the system better. So, like I said, to go through the process of change control, and if the change is actually justified and approved, it will be implemented accordingly. So some of the lean tools that will guarantee success include the 5S, which is sort, set in order, shine, standardize, sustain. The next one is value stream mapping, which I've talked about earlier. Then the SMED, which is single minute exchange of die. The Pokayoke, which is Japanese, that's the Toyota, they are Japanese word for that, which is error proofing. Then the standardized work and SOP optimization, cellular manufacturing, which will improve flow, and then the Kanban for inventory management. Next slide, please. So the 5S, that's the sort, set in order, shine, standardize, and sustain. You need to have a clean, organized environment. That is the first step towards good manufacturing practice. The lab, everything is clustered up and down. Your work environment is clustered and all that. It's actually poor. You're not practicing good manufacturing practice. Then you have to be able to solve. You need to, the sort application will include removing every expired reagents, broken equipment, organizing down in production, toolkits for tablet presses, and lab workstations to ensure that only the necessary calibrated equipment are present. They are reducing the risk of cross-contamination and line clearance error. So with these tools, you can actually get these things done. Next slide, please. Then the value stream mapping, like I said, you map the entire journey of the product from arrival of the API at the port and the recipients as well, up to through the production process, up through the delivery of the finished product to the pharmacy. You identify where the materials, products, or documentation sit idle. Those idle times are the wastes that you need to eliminate. You have the physical movement of materials, the products, and the flow of information and documentation. Like I said before, the batch records, quality control, release times, all that. You also have to map the time taken by all these activities and see whether they are actually optimized or there are wastages. Then you identify the dead time, where the batch sits idle waiting for lab results or QA signature. This SMED, the single minute exchange of dye, the pharmaceutical lines often suffer from long changeover times, like I mentioned before, from one product to another to prevent cross-contamination. So the SMED focuses on converting internal setup, that task done within the machine, that the period the machine is stopped within the area. You don't have to be organizing your dyes for the next one, no, because you have to do your line clearance. So trying to organize everything for the next batch should be done outside where other people could do that, so that by the time the line is clear, you bring in the next set of dyes and punches and everything you need, and then the operation starts. So the application, preparing cleaned changeover parts and tools in advance to maximize the stop to start time between different drug formulations. That's where you can actually apply this. Next slide, please. The POCA, that's the error proofing. You implement simple physical or digital checks to prevent mistakes. Like the mechanical one can be using fittings that allow only the correct tubing, like maybe gas tubings and all that. Only the correct tubings can be connected. The fittings will only work for that particular tubing, so that you don't bring the wrong one and start going back and forth. Then the digital one could be using barcode scanners, like for instance to ensure correct active pharmaceutical ingredients are added in the mix. So if you have labels the drums with barcodes, so use the scanner and you're sure that you're doing the right thing, so that you don't take the wrong the granules for compression. Next slide. Standardized work and SOP optimization. You know, the pharma industry is built on standard operating procedures. Lean focuses on making these procedures visual and intuitive to reduce human error, leading to deviations. So your SOP doesn't have to be a lot of tests. There could be some pictorials and all that will help the operators to easily follow and then apply. The application is you're using your visual aids, checklists, and color-coded step-by-step guides at the point of use to ensure compliance with bloated documentation. Because when you have SOPs on several pages, flipping through it in the process, the person may miss out some steps, and then that leads to out of specification products at the end of the day. Next slide, please. The cellular manufacturing is actually a tool that will improve flow. So moving away from batch and queuing, where large quantities of drugs sit in the warehouse between stages of production, towards more continuous flow, like I said, continuous manufacturing is actually will help you implement lean. So but it calls for a lot of investment to go into that. The application, you're reorganizing your layout even so that granulation, compression, and coating are physically adjacent to themselves. Not that they are far apart, that you have to waste a long time walking from this place to that place, and then you forget something, you go back and forth. So they should be sequential, so that one step leads into the next. And this will reduce the transit time and the complexity of material tracking. Next slide. The Kanban for inventory, we've talked about it. The pharma industry they carry a high risk of safety stock due to supply chain fears and all of that. The Kanban uses a pull system to signal when materials are needed. Like I said, managing reagents in the quality control lab, if you have maybe like two maybe sections where you keep particular reagents. By the time you pick up this and the remaining one, it's a signal that you should order a replacement so that you never run out of stock. So and that one is called the 2-bin system. It will prevent overstocking and expiration of components and reagents. So the 2-bin system in lean manufacturing is a visual inventory management method that uses 2 containers for each item. So one item will have 2 containers. By the time you take exhaust what is in 1 container, it's time for you to reorder and replenish the stock. That's like so some eggs waste in pharma is very obvious in production. You make large batches of low demand medicines that will expire in your warehouse. So it's an example of overproduction. Then the waiting. Operators waiting for QC clearance before the next stage. Transport, moving material between distant buildings. Maybe your warehouse is another. You have some work in process tablets or granules. You move them to the warehouse. Then you have to move them back when you now need to get them compressed. So that is transportation. Wastage is through transportation. The inappropriate processing, over-testing, or even when you have to do rework, all those things are inappropriate processing that constitute waste. Then inventory, excess raw materials, APIs, ATPs, lying in the warehouse, they are tying down capital. And before you know it, the retest date is there and is a problem. So motion, poorly organized workstations require operators to walk long distances from one operation to another. Then defects, batch rejections, rework, relabeling, all those things are wastages through defects. Unutilized talents. Sometimes we ignore even the operators on the floor. They have been working for several years. They have experience. They can spot out. So when I was in Swifa, there's one of the operators that without even in process checking the moisture content of the granules and all that, if he touches it, he will tell you whether it will pass or not. So we shouldn't overlook those operators. We should tap into their experience, whatever they know, give them that free hand to be able to bring it up to you, and that will make them to even feel relevant, feel valued. They have that sense of belonging. But when you look down on them, your ordinary operator, how dare you come and tell me your manager what I should do? Then you are stifling even when they see something going wrong, they'll keep their mouth shut. I'm not the manager. Before you know it, a whole batch is out of spec. So please, let us respect them and also value their own opinions. Even if eventually their opinions are not taken after you've done you tested it and all that, through your change control system, you should be able to explain to them why you cannot implement it. Not just to ignore them and tomorrow they say, this time I suggest something, my God, they take them, but why would I bring up another one? So the way we manage them will also enable us to tap some information from them. They have more experience. Like when I became the quality manager, I was from regulation, I was moved to quality. I knew nothing. I had to rely on them, on all my people, to learn. So don't you think that somebody who has been there for years and have experience, because you're the manager, you now start claiming that you know all. Tap into their experience. It will go a long way in helping you in your lean project. Next slide, please. So I think that's the end, and if we have any questions, we can take them. Or should I ask, how many people here work in quality control? Only you. Okay, can you not tell us the company you work for, even though some people may know? Can you suggest, it may not be in your organization, but from your experience, can you tell us some of those wastes that you notice that could occur in laboratories that need to be eliminated? All of us will learn from that.
Good day, everyone. So I want to talk about the analysis of ciprofloxacin lactate. Whenever we analyze it, we make use of the UV spec, and most times we have situation whereby we have to repeat the test. That's wasting of time in analysis, which will cause delay. So in doing that, if the instrument is well calibrated and everything is well placed, most times you call external calibrator to come and do calibration and in-house calibration. If it's well done and all your instruments are functioning well, that the lean method that I'm bringing up now will help us in cutting down the downtime, because you keep repeating the batch. So in the process, it will also help in reducing time. I'm coming from the angle of quality control.
Okay, but I have a comment about that.
Okay.
You don't test quality into the product.
You introduce it from the stage.
Because if you have to test and it's not passing and you keep testing, it's actually a compliance issue. If your equipment is it manual or automatic? Your HPS? Automatic. Was it qualified properly?
Yes.
And the analytical methods were validated?
Yes.
Then, if that happens,
It will be from the production. I know you talk about process validation too, that we should make sure that we do our process validation properly. So I'm just citing that as an example of incidents that will happen and how to eliminate it.
Under quality control, you won't see delay that can come out of quality control. Now, if you carry out analysis in the laboratories, you're supposed to give results and feedback to production. We should not wait until the production come to collect results of analysis to move on to the next thing. You should just take your time to give it out. You don't wait for them to come and collect results of analysis so that to move. So in order to move on to the next stage, take for example the moisture content analysis. Come in between to get results of analysis before we can move on to the next stage of production. Now you don't wait until when production have to run after quality control to collect results of analysis. In time, that to save time, don't wait, just give it to them. You are done. You have the results with you. They can move on to the next production. So you just go ahead and give the result so that you can move without any delay.
thank you very much. That's a good one, because production and the quality like in short, when we now have, I was in quality and then the production manager, sometimes there are the two of us boxing ring when we go for our management meetings. But then after laugh over it. So actually, if everybody is working as a team, there shouldn't be that kind of silos waiting for someone, because those are the wastages. Because if we buy, that's another issue. There's a lot of capacity building that the industry needs to have. Organizational culture is very important. And this prof that is supposed to the lecture that we can't take today is an expert in that. So when there's a culture of quality in an organization, everybody works as a team. So when I was in Normandy, there was a game we were playing that we go for our meetings, that we kind of form a circle, and I'll come to you and I'll ask you, okay, is there anything that's maybe my work relates to yours? I'll ask you, okay, is there any way I can help you? And if there's any way you can help me, I'll also tell you. So that way, everybody has ownership. It's not okay, I'm in QC, when I finish it, okay, let it be there. I don't have the time yet to go give them the result. No. If you're still running manual, you don't have laboratory information system now and you're doing manual, please don't delay results. It is wastage, it is money, and it is hard to the patient, and we all are patients at one time or the other. So even if you're not buying the product you're buying another one, so that company is also passing wastage to you. So who here is in production?
One of the core principles of lean manufacturing is establish a pool. That means you are producing based on the demand from the market. So in a situation whereby there is a surge and you have ramped up the production process in the facility, so you need a surge in demand. We need to produce this product, and it should be in the market in the next 1 or 2 days. And you know this process is going to take you, let's say, maybe 3 to 4 days. How do you work with that?
The marketing do their work very well. You understand? If they have good relationship with their distributors, they should be able to have some kind of intelligence to find out what could be going on. Are there some policy changes? Are there things that will happen? You know, that's one thing we know that our marketing team, they were top notch. So if they do their work very well, they should be able to sensitize you, okay, this is what you are going to expect. But then, if it happens like COVID-19, nobody plans for such. So in that kind of situation, of course, even the way that the COVID-19 vaccine was developed, it was magical. So everything has to be suspended. I tell you, because someone had already developed that RNA this thing, long time I was not recognized. And when that issue came up, it was easy to use that to quickly make the COVID vaccine. So, but if it's normal marketing, whatever, the marketing it's just that these days, I don't know why, so marketing team, they are very lazy. They don't even know their customers. They don't have relationships with their customers. I was a rep, I started as a rep. And I tell you, I was in the East, covering the whole of the East then. There's this hospital, children's hospital. The doctor will always call me. If they are going to need something, maybe I won't be in town at my base. He will call me and I'll make sure I send the products to him. So if you do your work well and have relationships, they'll be able to give you some information that will help you to plan and to store your production. I said the way we work that, and I don't see that now. One of my distributors, by the time I left the company, and I came into town, he gave me his card. He said, just move around, and then, because I was close to the family too, during the children's birthday, I go, I give them gifts and all. I said, during when they close, pick my children, drop them at home, use the card, give them, bring it back. So if marketing do their work well, there won't be surprises. Even if there is, it will be minimal. They'll be able to give you information in good time, for you to be able to meet up with their demands.
Thank you so much for the wonderful lecture. My question is how do we reconcile between just in time and regulatory compliance? Because in the manufacture or production setting, those are the major challenges we tend to encounter.
Okay, in pharmaceutical, we are actually interested in getting it right the first time. Get it right the first time. Don't do rework. And do it within the time if your process is validated. Just in time, doing it within that stipulated time. Not that it's going to now vary. Process variability is not going to help you to get it done just in time. And then getting it right the first time is very, very key to quality. Because once you start having deviation, managing deviation is not a good thing. I handled it when I was in Novartis for distribution, importation and all that, transport deviation. It was terrible. I had to take some strategic moves to make sure it doesn't happen, because then we're putting data logger on every of our products that were coming in, and then the government warehouse, there was no temperature control. So, and the process of our handling process deviation, I had to log it in. It has to go to the manufacturing side. They have to check their stability records to be sure that the excursion that has happened and for the length of time that product is still okay. So when that wasn't happening, I had to hold a meeting with customs. I don't want my product to enter that warehouse. Discuss with NAFDAC, discuss with all other agencies, and we agreed on taking our product, the distributor taking our product from the tarmac. So they had to do pre-release, they signed a bond with customs so that they get there. So when you have a problem, you look for a way to go around it. You know, so because problems are bound to occur. It was as if transport division was really what I was doing. I said no, I can't continue like this. So I had to organize that meeting. And what did I do? I printed one deviation report, old one like for oxytocin. And announced, I thought I was making the presentation, I told the man that look, this is for pregnant women, this drug. And if this product is administered, we are not sure of the quality anymore. The woman can die. He didn't allow me to finish the presentation. He said, please, 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 just tell your distributor, let them come and sign bond to carry your product from the tarmac. So, because in Novartis they said every product has a transport temperature, and they were putting data logger on every shipment, and we had to monitor that. So, all these things, we can do it. And one more thing I want to quickly say is please, I will encourage us. This program that I mentioned briefly, the Biotechnological Innovation and Regulatory Sciences program, I will encourage the industry to key into it. The program was brought by a Nigerian, but the people who are benefiting are East Africans. And it is a sponsored program. Bill and Melinda Gates have been sponsoring the tuition. It's just for people to pay their transport to come. Twice a year, we're going to Tanzania, but because Tanzania had issues, it may be moved to another country over there. But then we are kind of, the faculty are also already looking into, okay, how to set up a center in West Africa. So that at least even if it's once a year we'll go there, then the next one will go to East Africa, because they're already trying to set up a lab and production, a kind of simulation facility and all that, where we could get practical experience. I tell you, Reverend Zita, a pharmacist who brought this program, she has already received donations of 2 container loads of equipment. It's just a question of building the place and setting it up. So, and what the previous presenter presented, if you come to that program, you really learn the science behind it. You learn the science of quality by design. You learn all the QTPP and everything. You learn it from the beginning, the rudiments and all that. Because the time is too short, you cannot go into details. So I encourage all of you to key into the program. Africa, we are sitting on a gold mine. Pharmaceutical industry should be the next foreign exchange earner for this country. Yes, right. So thank you very much for your time.